Hi guys. Well, it's back. It's back. I'm back um, for more of this. Okay, so I've been digging into the other side of Amber's sister Whitney for one of the comments, one of the viewers in the comment section. Shout out to you. You know who you are. But always in the process of doing this, I always find other really interesting things. Like sometimes you wonder if Amber Heard realizes there's something called the internet and videos out there of her during these times when she makes these allegations. I'm gonna start off real quick, just doing this one. I mean, you'll see the point.
Did you experience any cuts on other parts of your body?
My forearms were cut. My bottoms of my feet were sliced up pretty good.
The bottoms of her feet were sliced up pretty good.
Did you have any other bruising or swelling?
I had a bruise across my jaw, I suppose.
Okay, just remember she got slices all over her feet. 2 days later. 2 days. 2 days later. Notice anything about those feet? I mean, I don't know how much dancing you're going to do, but she seems to be slipping them across the floor and standing up on them. And I mean, I don't know about you, but those feet look like they're functioning pretty well to me. Look, gonna put all of her weight on that left one and bend back on it. Yeah, I don't think she realizes. I mean, this is the problem with lying. This is the problem with lying. Look at that. I mean, just, she's doing a dirty dance and leaping to my arms. That, woo. Oh, and then there's that. But again, I don't, the problem is I don't think that this person thinks about, that's the problem with lying, right? When you lie, it's hard to keep up with your lie. You can't keep your story straight when you're lying. You just can't. Okay. And now I'm going to move on to this. Again, doing other research, you find some really good stuff out there. Like I found this Crushing Defeat Media. Only got four. I always try to do this while I'm live on air to show people I do this. 4.9 thousand like, because it matters. Look, this thing's almost got 75,000 views, and it should. And I'm going to show you why. I knew somebody out there would do a lot better version of this than me. I'm not a psychologist or a psychiatrist. I mean, but we can all smell bullshit, right? You don't have to be an orthopedic surgeon to watch somebody drag the leg behind them and think, there's probably something wrong there, right? But this person did such a good job of stringing those two psychologists together, Dr. Curry and Dr. Hughes. Kind of like he edited this together to kind of show you how deceptive that Dr. Hughes was. Like, you could feel it in some of the comments, but it's so hard when they're, psycho babbling all that bullshit out at once. And then it's like, wait a minute, that doesn't sound right. Sounds, didn't she just say she wasn't making a diet? Okay, just look, I'm gonna let you watch this. I'm gonna talk through some of it because when it comes up and just types, doesn't say anything. But this is so easy to see. Now I might have to boost the volume because we know how the court hearing's really low, and so then I don't want it to blare your eardrums out. Okay, I'll try to keep it from doing that. But this audio with this whole hearing has been jacked up.
Why are you here? I am here because my ex-husband is suing me for an op-ed I wrote.
Well, number one, that was her first screw up. First question on the stand. Her side was going to try and say, oh, she didn't title it. Oh, it was actually the ACLU along with like the Washington Post. They all got together and wrote this for her. She just, put her name to it because she blah, blah, blah. First thing she says out of her mouth, I wrote. Well, there went that argument.
And how do you feel about that?
Uh-huh.
That means it will happen again, no? Like I've seen the health class videos, like everyone else. And I got up in my car.
I've seen the health class videos like everyone else. I don't know what the hell they're teaching in your health class videos, but
Car. I walked to the car. I didn't say anything. I made a point to not say, oh, it's okay or anything like that. I just didn't say anything. I got up, I went to the car, I sat in my car, and I felt like I sat there forever. I didn't want to turn the key. I just leaned my head up against the window.
I'm going to say this because this is going to get into the Curry and Hughes thing, but I will say pay attention to this. It's amazing how many details that she remembers about her breath on a window or what happened to a certain piece of glass or a painting or whatever. But when it comes to like sometimes in these fights, well, I don't really know what happened after that. I just remember the next day. What it's like, I wonder why you remember what color socks you had on. But when it gets to kind of what started the fight, or maybe what happened here, or, I think I might have shoved him, or my arms were flailing around. But then it comes to her, it's like I was staring at the lint on the floor. It's like, yeah, no. I'm conveniently forgetting some shit, aren't we?
And I remember just seeing my breath on the windshield.
My goal is the truth. My goal is the truth because it killed me that people that I had spoken with, that I had met with over the years, who maybe were in a not such a great position and they needed advice, and I gave them the best advice I could. All I could think of was that those people would think that I was a fraud and that I had lied to them.
Now listen, to be fair, I'm gonna argue to say that I highly doubt that's the number one priority of all this. The truth, yes, but worrying about him giving, people worrying about him giving some advice, no. I'm sorry. Listen, I'm team justice for Johnny. I've been following this case for 2 years. I've listened to all the audio, all the stuff that's gone with it, stuff people are just learning about today. But I'm gonna be willing to bet that the number one priority here for him is to make sure that the rest of the world is aware of his side of what he says has happened, and everybody being able to hear the audio of her mocking him and saying, yeah, go ahead, go tell him, Johnny, see what the judge and jury think. Tell him Johnny Depp have been, a victim of domestic violence and all this. Like he needs people to hear everything that has happened, because for 6 years they've only heard her side. It's been the lead story when it comes to these two is Amber heard this and Amber heard that. This has been his first time and opportunity, but outside of the UK trial, which had everything to do with the son, and she wasn't on trial there. He couldn't bring in all kinds of evidence that he had. This is to try and set the record straight for people to know what really happened in that relationship. That to me would be Mr. Depp's number one priority. And of course, trickle down to that the people that he loves and cares about could trust him to know that, he did care to try and give them decent advice for sure. But I'm just going to be real there. But this is done really well. This dude has a degree in psychology and social. I can see why, because where he's chose to pick this, he's going to start with where he's chose to kind of edit this down and highlight. He does a great job of picking out what you need to pay attention to. Because I'm telling you, if this shit is not added up to your head, this right here will help you figure out why that is really effective. It's so funny he does that. So he's going to flip it and let Amber's go first. And yeah,
I diagnosed Ms. Heard with post-traumatic stress disorder. What these tests show was that there was a high degree of serious violence perpetrated by Mr. Depp toward Ms. Heard. In order to meet criteria for post-traumatic stress disorder, you have to have an actual cause. It's one of the few diagnostic entities that we have to have a cause for, and the cause was the intimate partner violence by Mr. Depp.
See what she does right there? The cause was for the intimate partner violence by Mr. Depp. She right there on the stand, she is claiming that what Amber Heard is suffering from, and the reason for it is because the abuse that she had to endure by Johnny Depp. Listen, that's how she presents that. That's how she said it. So she's on that stand testifying that she has her issues because of Johnny Depp and what he did to her physically. That's what she just said. Remember, she never spoke to Johnny Depp, never interviewed him, never got his side.
Now, I have really robust data that Ms. Heard is not malingering or feigning her psychological symptomatology.
But remember, she never talked to her 24-hour nurse, never interviewed her, the other nurse.
The results of Ms. Heard's evaluation supported 2 diagnoses: borderline personality disorder and histrionic personality disorder. I very
See what she does there? She says supported.
specifically was assessing to determine whether post-traumatic stress disorder was present, and it was not.
And you have not made any determinations, including any of opinions that Ms. Heard abused Mr. Depp or Mr. Depp abused Ms. Heard, correct?
Correct. That's outside of the scope of psychology.
Okay.
Which is why we also know that it's very inappropriate to convey any sort of opinion about whether a crime occurred, whether abuse occurred.
Mm-hmm.
She approached it in a manner that very clearly minimized any psychological dysfunction. Not just that, but really presented herself as free of any problems. And she did so in a way that was very, very sophisticated, not obvious. Ms. Heard did not have PTSD, and there were also pretty significant indications that she was grossly exaggerating symptoms of PTSD when asked about them.
This is good. This is what I like. They did here. It was really well done.
I met with Ms. Heard for a total of about 29 hours.
So the evaluation, we spent 12 hours directly with one another.
I met with her for the first time in September 2019.
I met with Ms. Heard on 2 separate dates, December 10th and December 17th, 2021.
I saw her for 4 visits in my New York City office, and then I saw her twice over Zoom.
However, there were more hours involved in the evaluation with some breaks. So
Yeah, and I like how he got into this, because if you watch this trial and you saw Heard's Dr. Hughes testifying on that stand, and remember, we'll get there where she says that she's not supposed to be making a judgment call on whether Johnny Depp abused Amber Heard or vice versa. But how she testifies on that stand, she's testifying exactly to that point. I mean, and then when she's cross-examined by the plaintiffs, and he questions it. No, I'm not determining whether or not there was violence, but how she testifies on that stand is exactly what she's doing. She is pushing that point forward, that everything she's determined by her, evaluation of Amber Heard is that Johnny Depp abused her. I mean, we're going to get to it, but I mean, keep that in mind.
And every time you refer to the characteristic of a victim of intimate partner violence yesterday, you used the pronouns she or her, didn't you?
I was using the she and her pronouns in this case because my determination was, as I stated, that Ms. Heard was the victim of intimate partner violence.
And then you say difficult for victim to extricate herself. You go on to say that she can and she should. Over and over, you use she, right?
Then he's saying, if you again pay attention to this testimony, even when she's talking in generalities, this Dr. Hughes, she always used she. When a woman, I mean, it was so apparent. Like when I was watching this live, it's like, I think I even tweeted something out about it. Like, this is what, to me, it screamed of gender bias. It screamed of believe all women. And as a woman, I will sit here and tell you that I know for a fact, I've known women that have blown things out of proportion out of spite. I've known women that have tried to trap men, but with pregnancies. I know women that have threatened men, threaten men to accuse them of doing things to them that they didn't do in order to get them in trouble. And I would be willing to bet the majority of women out there, and I've said this several times, know exactly what I'm talking about. And honest women out there, I know you're out there, honest women out there, see this and it sickens them. Because the only way you would do this to a man is if you're insecure. And to me, if you're a piece of trash, okay, whatever, something didn't work. You two didn't get along. He didn't want to be with you anymore. Get over yourself. If you're that incapable of dealing with adult situations, then don't do adult things like date or get married or get intimate with someone. If you have to blackmail someone into being with you, then you're the threat to me. You're the threat. People should stay 20 feet away from you. I'm telling you, men out there, if you're listening, run for the hills.
I believe in this case I did, because I was referencing this case where I found Ms. Heard to be the victim of intimate partner violence.
See what she just said? I did in this case because I found that Ms. Heard was the victim of IPV, intimate partner violence. Listen what she just said. I found. Then
That's a characteristic of abuse from women perpetrated against men. It's actually very, very common. About 90% of male victims of IPV have reported that a female partner who abuses them makes threats to report their partner as an abuser. It's less common for men to make that statement to female partners just because there's less potential consequence.
It's a common trauma symptom, isn't it, to not feel safe?
Sure.
And safety concerns are common among women who have been victimized, correct?
Women and men, yes.
The second main opinion was that that Ms. Heard demonstrated very clear psychological and traumatic effects, or the exacerbation of trauma, from those statements that Mr. Depp made through his attorney. There were 3 statements that we evaluated.
And you cannot testify whether Amber Heard suffered any emotional distress as a result of any of the defamatory comments that she has alleged Mr. Waldman made through Mr. Depp made through Mr. Waldman, correct?
What I can testify is that there was no indication of a decline in psychological functioning showing any injury since she's been with Mr. Depp.
And when you look at the consistency across the testing with the PAI, the TSI, and the MFAS, and there's research to support that when they go together, you have a higher degree of likelihood that this is not feigned PTSD, that this is not feigned symptomatology.
There are 20 kind of core symptoms that somebody can manifest with PTSD. You don't have to have all of them. Ms. Heard initially said that she had, in the first question, you say, do you ever have this, before you get to the more nuanced follow-up questions. When I asked that first question on each item, she initially said, yes, I have that, to 19 of the 20 symptoms. That's not typical even.
19 of the 20.
Of somebody with the most disabling form of PTSD. When we eventually sort of dialed it down, she had 3 remaining symptoms. And having symptoms of any disorder is common for all of us.
Actually, if I look at the validity scores on the MMPI-2 that Dr. Curry administered, those scales are not elevated for exaggeration or malingering either.
No, actually, that was something unique. When she completed objective broadband measures, where the questions, you don't know what the questions are getting at, they seem completely random. She raised scores that indicated that she was trying to minimize any mental issues and appear completely free of pathology. When she took tests that asked questions that were specific to trauma, that's when you'd see these extreme exaggerations.
Did Dr. Jacobs assign any diagnoses to Amber Heard?
She did. Early
one?
on, she diagnosed her with panic disorder, and then later with post-traumatic stress disorder.
All right. And did Dr. Jacobs diagnose Amber Heard with borderline personality disorder?
No, she did not.
Histrionic personality disorder?
No, she did not.
And is that important?
That's very important.
So when you're providing therapy, you're in a very different role than an examiner. When you're the forensic examiner, you're just really looking at data to make a decision. When you're a therapist, you're an advocate for your client's well-being. And in fact, it's considered extremely unethical for a treating provider to ever provide opinion testimony like I'm providing, because it's so well known in our field that you're going to have an automatic bias for your client.
This was deemed, under your PAI, a critical item. And it says, sometimes my temper explodes and I completely lose control. How did that potential for aggression bear on your analysis?
Well, there's a few things. Number one, certainly Ms. Heard reported to me that in her relationship that would happen. Her anger and her affect regulation would become impaired. Number two, you have to look at the total scales where that scale is not elevated, so it would not be a major cause of clinical concern. Number three, she had 4 responses that she could say to this question. Mainly true, very true, mainly true, sometimes true or false. She chose sometimes true. So she's answering honestly about her experience.
But right away, you get a list of what's called critical items. And these are just some, a couple of the items, the statements that are presented that are more clearly symptom-based. Ms. Heard had the clearest code type was 3-6. So a 3-6 code type, a lot of that anger is expressed in this code type. There can be actually a lot of cruelty. Usually with people who are less powerful. Actually, when you see this code type, you want to, if you can, to follow up with subordinates, co-workers, people who may have observed their behavior more closely. A lot of suppressed and denied anger, but the anger is very present, will explode out, and a lot of issues in their close relationships.
And these are all self-reports, right?
Correct.
And so she scored a 0 on doing something violent because you were so upset.
Correct.
See that language? You knew.
Now think about what is about to be said right here. The definition of now violence has been molded and crafted and changed and oozed into, I don't know what you want to call it. I'm about to explain that apparently Amber Heard's violence is excusable because apparently it's in retaliation to something. Like, that's just, here you go.
Knew Ms. Heard to do violent things when she's upset.
This test specifies how often have you had these symptoms in the last 6 months?
Just in the last 6 months.
Correct.
All right.
Now think about that. In the last 6 months, they got divorced 6 years ago. She's testing her for the last 6 months. So even when she saw her in 2019, they were nowhere near having a relationship. It'd been 3 years.
But also, people with borderline personality disorder, it seems to be a predictive factor for women who implement violence against their partner. And one of the most common tactics that they'll use is actually physically assaulting and then getting harmed themselves. But mostly, we call this administrative violence. So essentially, this is saying that they'll make threats using the legal system. So
And you did, an interview, I think, with Ms. Heard's mother, Paige.
That's correct.
And she told you that she loved Johnny even after Amber alleged abuse, correct?
She did.
All right.
Of the 5% that are IPV perpetrators that you've treated over the last 8 years, how many of these perpetrators have substance abuse issues? And your answer was?
I see that I answered with a figure of speech, a large portion.
Okay, thank you.
So what this references is the event you said was the worst, and what you have filled in here is 3 words, IPV by Johnny, right?
Now, remember, this is the same person that gives seminars and teaches classes basically on how you testify in court. And she can't even bother to fill out the form. I mean, there's a big blank box over here about what happened. Like nothing's in there.
Correct.
All right. And then what happened is the next box, and you've not written a single thing in the box, right?
Because I've already spent 20 some odd hours with Ms. Heard, I know what goes in that box.
You did not disclose in any of the designations or your report that you had met with and had dinner and drinks with Mr. Depp, did you?
Now think about how they're trying to frame that. You had dinner and drinks with Mr. Depp. You hoe. She went and had an interview with his legal team and him. It wasn't him and her. She's married. Remember, we're about to get to Muffin Gate where her husband bought the muffins. So there are some classy people in the world that don't see Johnny Depp and think, I'm going to cheat on my old man.
I'm sorry, can you repeat that one more time?
Yes,
That
you did
confused
not
me.
disclose in any of the designations or in your report that you had dinner and
Now watch what she got. You said she kind of faded away. She went over there to pick up a piece of that big old stack of paper that Amber Heard sides constantly got everywhere. She went and picked it up like, I dare you to say, something that watch.
drinks with
What,
Mr.
see right
Depp,
here?
correct?
I
Look
did
at her hand, how she's holding it up like she's going to serve her a smack your face.
not disclose that I was interviewed by the legal team, no.
And then there's this question that says, how often has this happened in the past month? Number of times.
Correct.
And we talked about how these things are scored, and we looked at, you got to look at frequency and intensity, right?
Correct.
And you left the frequency box blank.
Well, no, if she said several times a month, then that's what the frequency is.
And you didn't fill that frequency box in at all. How often in the past month? You left that one blank again, right?
She tells me it happens at least twice a week, so certainly I could multiply 2 times 4 and put in 8.
Yeah, she could have put 8 right there, but she didn't. The point is she did.
Is frequency and intensity. How often in the past month? Again, you left it blank.
If you look on the right-hand box, that is where we are indicating the frequency and the severity.
Are you trying to resist that you didn't have dinner with Mr. Depp and drinks?
I'm not,
See how she tried to frame it, or you tried to resist that you'd have dinner and drinks with Mr. Depp. I mean, this means it's her, to me, Amber Heard's side is grasping at straws to try and take this angle with
trying
this
to
lady.
resist that, but it's not quite right.
You
What
did
you're
have dinner
stating.
with Mr. Depp, did you not?
I did,
See?
with
You
his
You had
legal
drinks
team
with
and
Mr. Depp, did you not?
And what?
You had drinks with Mr. Depp, did you not?
Drinks were served. This was over 2 years ago. I may have had a drink with dinner, yes,
In fact, you thought you had a mule something, right?
possibly.
Again, we have, in the past month, how many of the important parts of event have you difficulty remembering? Number of important aspects. Didn't fill it up.
Well, I listed 2 specific incidents of where she indicates she has important aspects that are missing.
And you justified that it was okay in this case
Oh, Lord.
because it was a high-profile case.
That's not quite right. I justified it in this case. Actually, I sought consultation about it. First of all, the person who had retained his attorneys was unable to come to my office with his attorneys. And yes, this is a very visible case. It's been going on a very long time. And I understood that there would be a need to interview me and make an informed decision about my qualifications.
So just so you and I are on the same page, and I think we are, this gold standard test that I'm referring to is the CAPS 5.
That is correct.
That's the one that Dr. Curry administered, correct?
Correct.
All right. You didn't administer the Cap-5 until after you'd already diagnosed Amber Heard with PTSD, right?
She had PTSD in 2019. She had PTSD.
She's not answering the question. The one test that you should administer to someone to make that determination, she didn't do it to the very end. And now she's going to ramble on. Oh, the year she had it. She is going to diagnose her with this before she even did the test to try to determine whether or not she had it.
In the beginning of 2021 when I evaluated her, and then she had PTSD in December 27th, 2021 when I administered the caps. That's correct.
All right. I think I asked a much more narrow question than that.
You were, in fact, so excited about being involved in this case that you told your husband, even though this was a highly confidential.
So good. See the angle they're trying to take. Here comes Muffin Gate. First, it was this woman sat down to have dinner and drinks with just Johnny Depp. Forget that there was a boogle of other people in there called his legal team. You know, they tried that angle where, you know, oh, you didn't tell everybody you were, you know, having romantic candlelit dinner with Johnny Depp, right? Oh, because I wasn't. I was with all these people too. And that now they're going to take the angle of her husband. Like, which is it? Is she a hoe cheating on her husband? Or now is she's such an open person with her husband, she's gonna tell him everything? Which is it?
Matter that you were going to be conducting the examination of Ms. Heard, didn't you?
That is not accurate.
You not only told your husband, but you told Ms. Heard that you told your husband, correct?
Ms. Bredehoff, that is not accurate.
What is accurate?
You're incorrect. That is not correct.
Is your testimony today under oath that you did not tell your husband that you were going to be conducting the examination of Amber?
That is my testimony.
Let's go to page 306. So the question that was asked was because you brought muffins, you said, from your husband, right? You gave those to Ms. Heard, correct?
May I clarify what occurred so that we can stop talking about the muffins? What happened was that I was getting ready that morning. I frequently bring muffins to the office. My husband did happen to know that there was going to be a celebrity client coming in because on the mornings that occurs, which often occurs, we have to actually clear the office and move the staff to the other office. So yes, on the one hand, he was aware of that. I was getting ready. I asked him to go to the bakery near our house and pick up the muffins for me because I was running late. He often has to do that because I often do run late. He brought the muffins back to the house. I brought them into the office. Ms. Heard and I enjoyed the muffins together. I think I made a comment to her along the lines like, we can thank my husband, my husband got these for us today, meaning he purchased the muffins. We are now enjoying them because of him.
You're a professional witness.
I'm sorry, but that was one of the funniest things that happened while she was on the stand. That's how they tried to corner her.
That's not correct.
Over damn muffins. Over muffins. And they still try to insinuate this. He bought the muffins for Amber Heard. He bought the muffins for his wife. You know what I mean? He went and got the muffins because his wife asked him to, not because Amber Heard is coming in.
Because of him.
You're a professional witness, correct?
That's not correct.
No? You make hundreds of thousands of dollars a year testifying in court, correct?
Not testifying in court. I conduct thorough,
Now
comprehensive.
listen to how this is listen to Slimy here. What she says is not testifying in court, but what she does is do analysis for legal teams and they don't make it to court. Okay. Same thing though. She's still charging people to do what she's doing here. They just don't make it to court, so she doesn't have to testify. Okay.
Testifying in court, correct?
Not testifying in court. I conduct thorough, comprehensive psychological evaluations of individuals who are involved in a court case.
See,
So
involved in a
you're
court.
not being paid $100 an hour. How much are you getting paid?
I'm being paid $500 an hour.
$500 an hour. And that's what, and that's the bill you sent for your deposition, right? $500 an hour.
Correct.
Did you say on pages 305 and 306 that you frequently have examinations of high-profile clients? You want to just take a quick look and tell us?
305, 306?
Yeah, that's where we're talking about it.
Is there a line you'd like?
And see how condescending her side is. Yep, that's where we're talking about it. Like they do this with every person on the stand. How hateful they are to these people. It's just unnecessary. You can get the answers without acting like assholes, and they all act like assholes. Like now that we flipped to Amber Heard's side, now she's coming. Oh, Amber, what can you tell me, sweetheart, about your horrible blah blah? And even like it's so obvious that I don't know, it's just unnecessary. So that's why people really have a disdain, not just for Amber Heard's accusations, because we have so much evidence out there, the audio files and stuff are admitting she put her hands on him, Johnny Depp, I mean. But it's also her legal team. They're slimy. They try to get in testimony that they're not allowed to get, and they do it all the time. And then it's how they treat the people on the stand that's unnecessary.
Like me to look at?
You can start with 15, line 15, 305. Just read through that and tell me whether you said anywhere in there that you have a lot of high-profile examinations. You do this frequently.
Objection to improper impeachment.
I don't agree.
I don't. She always says that when she gets an objection. She's like, "I don't agree." That's not how she'll argue with the daggum judge when she's standing there. I'm definitely sharing. Oh, look, here we go. This is good.
Main opinion is that Ms. Heard's report of intimate partner violence and the records that I reviewed is consistent with what we know in the field about intimate partner violence.
See, look.
You have not formed an opinion as to whether Mr. Depp committed intimate partner violence against Ms. Heard, correct?
Correct.
See? Now think about that. I want you to hear this again. Think about what she just said before. My main opinion. So she's saying here that she's formed an opinion. Is that Miss Heard's report of intimate partner violence in the records that I would think about this slimy shit.
And the
Now, what
records
about
that I
her?
reviewed is consistent with what we know.
Now, my opinion is it's consistent that what we know. So no one, man, this is slimy, because if you're not paying attention, and if he didn't have the lawyers he had, how she worded that and what she's saying on that stand is that her opinion is that she suffered from this. That's what she said. He
In
didn't
the
ask that
field
direct
about
question,
intimate
but no.
partner violence.
See? No,
You
again.
have not formed an opinion as to whether Mr. Depp committed intimate partner violence against Ms. Heard, correct?
Correct. The basis of the opinion was looking at all the dynamics in this relationship, looking at not just the hitting and the yelling, but looking at how much more hitting was done, looking at the coercive control, the obsessive jealousy, the possessiveness, the sexual violence, the choking behavior.
Listen to what she's saying right here. The choking, all this other, she has no evidence of this. Yes, exactly.
And you're not testifying to the veracity, the truthfulness of any of the allegations.
Correct.
Mm-hmm.
Any etiology was associated with the post-traumatic stress disorder?
So the etiology is the cause. In order to meet criteria for post-traumatic stress disorder, you have to have an actual cause. It's one of the few diagnostic entities that we have to have a cause for. And the cause was the intimate partner violence by Mr. Depp.
You have not formed an opinion as to whether Mr. Depp committed intimate partner violence against Ms. Heard, correct?
Correct.
Look, see that? Look. So the cause of the PTSD diagnosis for Amber was the IPV that Dr. Hughes isn't testifying happened. You following? Crazy.
Excuse me, I choked a little at my water.
She also indicated, using, and as some of the testing showed, minor forms of violence, pushing, shoving, throwing objects.
Minor. Now it's minor if she does it. This is a gender bias.
Reported to you that she engaged in low levels of violence, correct?
Well, I don't think she said that. I think that was the characterization of knowing the types of minor and severe levels of violence.
Okay, I got it wrong. You consider it low levels of violence.
Well, I considered what the literature and the research talks about low levels of violence as opposed to severe levels of violence.
You reviewed photographs.
Yes.
All right. I'd like to put up PX 144.
This is great,
It's
too.
been published to the jury briefly. I'm going to keep it up very briefly. That photograph doesn't reflect a low level of violence, does it?
Well, that reflects a severe injury, I would agree.
Yeah. Why don't we go to PX 145? That's a severe injury that ended up with Mr. Depp on a gurney, correct?
That is a severe injury, correct.
Does that make Amber Heard a perpetrator of intimate partner violence?
Objection leading.
Overruled.
So that was one of the tasks that I had to consider. That was one of the hypotheses that I had to consider. And given all of the other data, that was not my opinion.
I think this does such a good job of comparing the two and how that slimy witness literally sit on that stand and was like, well, my main opinion is that Amber Heard was subjected to the, to the IPV by Mr. Depp. And then when cross-examined, you're not forming an opinion. That's correct. Like, do you understand how nuts that is? Okay, and I'm going to string this one with it. This was another a video done by this person, this Crushing Defeat Media. This is highlights of the Curry. I think it's important because he goes to the tests that she administered and how important they are, because this person has a degree in psychology, and so I think he said sociology. Is that I think this is important to look at as well, because to show you the test she performed and why she performed it. It's done really well. So again, shout out to this person, because I knew somebody out there would do a good consent, compare these videos and then give an opinion that's a lot more valid than mine, with a lot more experience.
Right. Would you agree that all perpetrators of IPV have anger management issues?
Yes.
And a large portion of IPV perpetrators have substance abuse issues.
It's one of many factors that correlates with intimate partner violence, but there are certainly many people who perpetuate intimate partner violence who do not have substance abuse issues.
Right.
Yeah, and this is where we saw this in the
Of
other.
the 5% that are IPV perpetrators that you've treated over the last 8 years, how many of these perpetrators have substance abuse issues? And your answer was?
I see that I answered with a figure of speech, a large portion.
Okay, thank you.
Yeah, correlation is not causation. Mm-hmm.
And it's common for the perpetrator to essentially gaslight the victim, accuse them of being the perpetrator. Would you
Now,
agree?
this is really interesting, because I think, like this video puts together, I think her side is so caught up and thinking that they're proving their point, they don't realize what they do right here. I'm going to back it up just a little bit. And it's common for the perpetrator to essentially gaslight the victim. Now, watch what they do right here. It doesn't work the way they think it's going to.
Gaslight the victim, accuse them of being the perpetrator. Would you agree?
Mm-hmm. Yeah.
That's a characteristic of psychological abuse, yes.
Okay, and it's common then for them to accuse them of being the perpetrator, the victim.
That's a characteristic of abuse from women perpetrated against men. It's actually very, very common. About 90% of male victims of IPV have reported that a female partner who abuses them makes threats to report their partner as an abuser. It's less common for men to make that statement to female partners just because there's less potential consequence.
Mm-hmm. See,
And it's distressing for the victim to be accused, is it not?
Absolutely.
It causes them a lot of fear,
Certainly.
and it causes them a lot of distress.
Absolutely, yes.
And in fact, they feel falsely accused, correct?
Yep.
They feel
false.
falsely accused.
They don't realize they're
Correct.
describing him.
Yes.
And they feel paranoid.
I don't think
Yeah.
they realize what she said. It's more common for women to threaten men with it, and they're just rolling on like they're still referring to her, and they're referring to him.
Yes.
And they feel frightened,
Yes.
afraid that everyone's going to believe
Yeah.
the perpetrator, correct?
Yes.
And in fact, they're afraid they're going to lose their security, correct?
Can you clarify what you mean by security?
I'll ask the next one. And they're afraid they're going to lose their reputation, correct?
Yes.
Now let's talk about the testing for a moment.
This is interesting, right?
You talked about the MMPI-2, but that's not the most recent MMPI, is it?
No, it's the most researched.
Okay. Now,
See, this is important. It's used to assess. It assesses 10 categories of abnormal behavior and has 4 validity scales to determine if the answers are true. Heard's lawyers mentioned that not being the most recent MMPI to try this predator. The Office of Aerospace Medicine said about the other MPIs from November 18, 2020. FAA found the MMPI-2 is less sensitive than the MMPI-1-2. The P13 is simply a revision of the PI2FR, and the marketing of that's too fast. And the marketing of the MMP13 does not reflect the science. Okay, so understand what they're saying here. They're inferior. They're inferior. The FAA found the PI2RF to be less sensitive than the P12. And the P13 is simply a revision of the 2RF, and the marketing of the P13 does not reflect the science. So yeah, sounds like it's not only the most researched, but also the most accurate.
on the MMPI, there was only one section that had elevated scores, correct?
No, that's not correct.
It was the K section, correct?
Just keep going.
That's not correct.
Okay. And was there any elevated score over 65 on the MMPI?
I would need to take a look at it. If, I provided a 25-page interpretation outline. If you're able to pull that up, I'd be happy to go over any of the individual scores for you.
They don't want to, yeah. Now, again, that she testified first. What's interesting is they will not pull up her outline, her conclusions, what she gathered from the test. They will not show it to her. When Dr. Hughes, their expert witness, got on the stand, that woman brought a stack of freaking folders. And she was allowed to look down and reference her pages. This woman was never allowed to do that. So she was they withheld they held on to the fact that they could bring her back up on this on the witness stand, and I hope that she brings her report up there with her so she can reference it just like theirs did. I mean, she had a stack of folders. They were colored, like I think like blue and like pink or something.
Can you recall any clinical scales for the MMPI-2 for Amber Heard that were above 65 as you sit there today?
Again, there are multiple scales on this test, 25 pages worth listed. So if you can pull it up, then I can review and give you a confident answer.
What can you recall as you sit there?
I'm hesitant to do that because I don't want to make an error by ignoring hundreds of scale scores.
And would you agree that you can't make a pathological determination or diagnosis if the scales are not elevated on the MMPI-2?
I would not agree with that.
Well, it's a common trauma symptom, isn't it, to not feel safe?
Sure.
And safety concerns are common among women who have been victimized, correct?
Women and men, yes.
Okay, and
See how she has to constantly remind them that men can be victims. So they all want to reference women. Again, I believe this trial is highlighting a lot more than just some of the lies that have been told over the last 6 years. I think it's highlighting why men don't feel comfortable of talking about whenever they're victimized by a female partner. Because look at Amber Heard's, their expert witness and even her own counsel constantly talking about women. Constantly saying women, like that men can't be victims.
and memory difficulties. Amber said she felt she had holes. Do you recall that?
I do. And her account was different than typical memory difficulties with trauma.
It is common for individuals who have experienced trauma.
And it's actually not common. No, it's a symptom, but it's the least common.
Mm-hmm.
Now let's talk for a moment specifically about a couple of the profiles on the MMPI. This is not an exaggerated profile for her, is it?
No, actually, that was something unique. When she completed objective broadband measures, where the questions, you don't know what the questions are getting at, they seem completely random. She raised scores that indicated that she was trying to minimize any mental issues and appear completely free of pathology. When she took tests that asked questions that were specific to trauma, that's when you'd see these extreme exaggerations.
Mm-hmm.
Now, is it your testimony under oath today that you have not been asked to testify concerning Ms. Heard's behavior in the context of her relationship with Mr. Depp, including any abuse?
That's correct.
Okay.
Mm-hmm.
And you have not made any determinations, including any of opinions that Ms. Heard abused Mr. Depp or Mr. Depp abused Ms. Heard, correct?
Correct. That's outside of the scope of psychology.
Okay. And you cannot testify whether Amber Heard suffered any emotional distress as a result of any of the defamatory comments that she has alleged Mr. Waldman made through Mr. Depp made through Mr. Waldman, correct?
What I can testify is that there was no indication of a decline in psychological functioning showing any injury since she's been with Mr. Depp.
You cannot testify one way or the other on that, correct? Your Honor, may we approach? Okay. Dr. Curry,
Yes.
in your report, nowhere in your report did you provide any opinion of whether Ms. Heard suffered emotional distress as a result of the defamatory statements. Is that correct?
That's correct.
Okay, thank you. I have no further questions.
All right, redirect.
Yeah, they didn't want to go down that road.
Dr. Kerr, you were just asked a question about malingering.
Yes.
Is there another test that you did to make a determination with respect to malingering?
Well, malingering is a term that most psychologists, we try to be careful of it because it indicates an intent for secondary gain. I prefer feigning, which you had brought up earlier, because it indicates that somebody is intentionally exaggerating, but I don't know necessarily why. So I think that's a more accurate term in general. On the MMPI-2, yes, there was no exaggerated profile. I also gave her the CAPS-5. I don't know if you'll remember, but that is the clinician-administered PTSD scale.
Mm-hmm. National, it's about psychology Bible. Here it is.
Consistent with the DSM-5. And on that, there were signs of gross exaggeration. I also looked at the test results that were provided by Dr. Hughes, and on an objective test of trauma, there is a scale specific to intentional exaggeration on that test, and Ms. Heard was in the 98th percentile, meaning that she is she had engaged in extreme levels of exaggeration.
You were asked about intimacy problems, relationship difficulties associated with IPV, and you then said that there were some key differences.
Yes.
What are those?
So what you see when we're talking about the personality disorders is there is a very consistent pattern of the aggression, the violence, the irritability. First of all, it's escalated. But second of all, it occurs when there is either, for the borderline component, a threat of abandonment, a perceived slight, feeling like the person is about to leave you, about to walk away to get some space from an argument.
What? Oh no, I want to know.
Yeah,
I want to know.
get out your Ubers
I'm
out.
kind of waiting. You go get it.
Yeah, I'll be in.
Wait, is there no other place for you to run in your 15 other houses to go run? Come on, go be a real married man and go deal with your shit the way that a man does. Go run in the next house. Every man does.
Yeah.
Go. Run away. I know it's hard to
You're
look at yourself.
fucking ridiculous.
It also occurs to a more mild extent, but when there's a loss of attention and a need to manipulate to try to get that attention back. But it's not, when somebody has PTSD, that irritability is sort of at a low, constant level, or it's completely random. It's a very different type of presentation. IPV, it might be more irritability, but that's actually less of a symptom for female IPV victims. Usually what you'll see is somatic symptoms, the depression. A lot of fearfulness and anxiety, but typically more complaints about somatic symptoms. So when you're providing therapy, you're in a very different role than an examiner. When you're the forensic examiner, you're just really looking at data to make a decision. When you're a therapist, you're an advocate for your client's well-being. And in fact, it's considered extremely unethical for a treating provider to ever provide opinion testimony like I'm providing, because it's so well known in our field that you're going to have an automatic bias for your client. It's almost sense of protection, advocacy, wanting their best, which is why we also know that it's very inappropriate to convey any sort of opinion about whether a crime occurred, whether abuse occurred. We can certainly believe our clients. We can support them in their therapy and take them at their word. We're taught, we're trained to stay away from making any sort of opinions, understanding that most of the time, and most of Ms. Heard's providers were just treating Ms. Heard, and they're going to be advocating, and the treatment relationship is about helping your client achieve well-being, not making formal psychological or psychiatric opinions.
Mhm.
Dr. Cohen, treating physician?
Yes, he was a psychologist.
Yeah. Dr. Banks, treating physician?
Dr. Banks, yes, treating psychiatrist.
Dr. Anderson?
Yes, treating psychologist.
Every one of them had to take Amber Heard at his word, right?
Yes.
Yeah, I think this person did such a good job. And I hope that you enjoyed it. Again, this was the Crushing Defeat Media that you already liked it here. I think that, again, they did a much better job than I could do of kind of comparing the two. And I think it was obvious which one was, not gender bias, not acting like a man can't never be a victim, regardless of when they were pushed on it and trying to backpedal. We all listened to both of their testimony. I'm curious to see how the week will go. I'm going to start trying to do research for my other video that was requested by one of my viewers. And I hope you like what you see. Please, you know what to do. If you like it, you like it. You know what to do. You watch enough YouTube videos. With that, I'm going to sign off. And you guys have a good rest of your weekend. Well, I'll probably upload this tomorrow. Today's Saturday, tomorrow's Sunday. So, hey, have a great Sunday. I will talk to you later.